along as thank you, Charity. Good evening. Welcome to Muna's webinar today. Today's webinar is focusing on what happened yesterday, and yesterday was the day of elderly abuse awareness across the globe. We were recognizing the importance of ensuring that we safeguard and protect our elders in our community. And for those of you who were with us about 2, 3 weeks ago, we had a podcast where we had Judge Zone talk about elder abuse and set the groundwork for us in terms of understanding what is elder abuse within Malawi and what does that look like and what is the current law in place and what is government trying to do about it and what that looks like on a day-to-day basis. And what we want to do today is to have a conversation. So we have some fantastic speakers with us. I will introduce them as they come in. I know they're struggling to come in, but I am hoping that they will come in. But before that, my name is Sala, and I'm one of the executive members of Muna. Before I go any further, I just want to give some space to our president, Charity, to say a few words. Charity, I'm going to pass across to you.
Good evening, everyone, and a very warm welcome to today's webinar on elder abuse. On behalf of Malawi and UK Nurses Association, I would like to thank our speakers, our partners, our healthcare professionals, community leaders, and every one of you joining us from United Kingdom, Malawi, and beyond, wherever you are. So we had this conversation just a couple of weeks ago, as Salah has alluded to, but this is a very important and pertinent conversation, but not always an easy one, because abuse of older people always remain hidden, and you know this. It may happen behind closed doors, within our families, within the community, in our churches, and sometimes it's deliberate, but at times it occurs through neglect, lack of awareness, harmful attitudes, traditions, and also sometimes the system fail to recognize and respond to our older people's needs. So, what do we mean by elder abuse? So, I mentioned this the last time that the World Health Organization describes it as a single and repeated act or failure to take appropriate action within a relationship where expectation of trust, which causes harm or distress to an elder person. And this can include physical, emotional, it can be psychological, it can be sexual abuse. We know we've had it so many times, financial exploitation and also abandonment. And all this leads to loss of dignity and respect. So I don't want to chew a lot of time because we've got a jam-packed agenda. I'll let our speakers really speak into this. So globally, the World Health Organization estimates that approximately 1 in 6 people, here, people aged over 60 experience some form of abuse in community settings each year. And behind these statistics are individuals. They are our colleagues, our parents, it can be our grandparents, our neighbors, our patients, and members of the communities that we value most. And what does this mean for us here in the United Kingdom? In UK, elder abuse is considered within the wider framework of adult safeguarding. The Care Act places responsibilities on organizations to protect adults within the care and support, and also for those that are experiencing abuse, neglect, and unable to protect themselves. And what does that mean for Malawi? So for Malawi, we've got colleagues from Malawi, and thank you, Tidziwe, and colleagues from EGAF, Enrich, and Malawi Human Rights Commission as well, Mr. Kavala, who also be setting the scene. So in Malawi, many older people are respected and are custodians of our culture, their family history, You know, those days I used to go to my grandfather, go tell me a story. So they hold the wisdom. And yet this respect does not really guarantee protection in practice. Older people may experience poverty, limited access to healthcare, social protection, neglect, isolation. So there's so much, but I will let our esteemed speakers do it justice. So Muna is holding this webinar because protecting older people is a matter of health, is a matter of human rights, it's a matter of dignity, social justice, something that I'm really passionate about. And as nurses, midwives, and healthcare professionals, we are in a position to see what others might not see. So there you go, Salah. Over to you.
Thank you, Charity. And as Charity has said, today's conversation will be uncomfortable because we will raise things that are happening daily with our elder population, our what we do to or what we have seen is happening to Antwapula Kulu. It as Gogoatu in our homes, in our communities, in the hospitals, in the legal system. And because how we treat our older citizens is not just a healthcare issue, because we're healthcare professionals, it is a legal issue. It is an issue about humanity, and it is an issue about our community. And as Charity has rightly stated, we've got some amazing speakers, and I will introduce them as they come and talk one by one. So just to give you an outline of what we will be expecting today, we will hear from Mr. Andrew Kavala, who we already have on the screen. And we will also hear from Didio Malinki. Oh, there we are. We've got you on screen as well. And we've got Ethel and Gift Gausi, who will also speak with us. And we're hoping that Justice Zonentaba will also come and talk to us.
Is Ethel here?
Yeah,
I
yeah.
Yes, Ethel. So Charity, if you're able, what we will do is
Are
when
you
the
able to put
speakers
your
are,
cameras?
yeah, she's on. I think she's under Ethel Chimpanga. Am I right, Ethel? Yes. So are we able to sort of pin her as well so people can see her? So in terms of run up, our speakers will have about just under 10 minutes to just give us a talk about what they're doing in that space. If you have any burning questions, please put them in the chat, but we will have a Q&A session at the end. So we want our speakers to have that opportunity to share their experiences. And as a start, I want to introduce Mr. Andrew Kavala. So welcome to come into this space. Before Mr. Andrews comes in, can I just ask all our speakers and all our members who are online, please keep your mics muted, keep your cameras on if you're able to. We are recording this session. Um, and if once again you have questions, please put them in the chat. So, Mr. Andrew Kavala, he is the executive director of the Malawi Network of Older Persons Organization, what is known as MANEPO. So, for those of you who've heard of MANEPO, meet Mr. Andrew Kavala. He is a leading national consortium advocating for the rights, dignity, and well-being of older people in Malawi. He also serves as a commissioner of the Malawi Human Rights Commission and is an expert member of the African Union Technical Working Group on the rights of older persons and persons with disabilities in Africa. He is a very, very respected human rights advocate, and Andrew has been at the forefront of advancing the rights and inclusion of older persons through policy reform, strategic advocacy, and social justice initiatives. He also holds both a Bachelor's of Arts Humanities and a Master's, an MBA from the University of Malawi. So, a very proud son of the soil of Malawi, and he's currently pursuing a PhD in social sciences with a focus on aging and development at Northwest University in South Africa. Mr. Kavala, the floor is yours. Welcome. Takulandirani.
Thank you so much, and thanks for to Charity for setting the pace. Yeah, I have less than 10 minutes, so I'll straight go into my presentation. So As we commemorate World AIDS Abuse Awareness Day, we must acknowledge the difficult reality that is there. Awareness alone is not enough. For many older persons, abuse remains a daily experience despite the growing public recognition of the problem. The question before us is not whether abuse exists. The question is whether our institutions, our laws, our communities, and other systems are sufficiently equipped to prevent AIDS abuse, detect it, and even respond to it very effectively. So for Malawi, the conversation is particularly timely as the country enacted the Older Persons Act in 2024, creating a historical opportunity to move from awareness to accountability and action. Perhaps I give some very brief demographic context. So Malawi is experiencing a gradual but significant demographic transition. As I speak now, projections indicate that Malawi has approximately 1 million older persons, those aged 60 years and above, representing around 5% of the national population. This number is expected to increase steadily in the coming decades due to a number of improvements in life expectancy and some health care here and there. So aging is therefore no longer a future issue. It is a present development. It's a human rights issue. It's a public policy issue in Malawi. And a growing number of older persons requires deliberate investment in a number of systems, say social protection, health care, long-term care services, legal protections, and age-inclusive development policies. And failure to act now, failure to act today will increase vulnerability and expose more older persons to abuse, neglect, exclusion, and poverty. Now, understanding AIDS abuse in Malawi remains an issue that we keep to discuss quite constantly. So AIDS abuse in Malawi remains widespread, but largely underreported. So we have many cases that occur behind closed doors and are often perpetrated by individuals known to the older person. And I must be frank here, AIDS abuse does not come from without. AIDS abuse comes from the very close relations of older persons, family members, those that live very closely with them all the time. So we are looking at the elder abuse that is being perpetrated by family members, caregivers, neighbors, and community members. Charity already spoke about the various forms of elder abuse, physical abuse, psychological and emotional abuse, economic and property grabbing, a very serious form of abuse, neglect, and institutional abuse. I want to go straight into some of the key drivers of elder abuse in Malawi. So, elder abuse does not occur in isolation. It is often driven by persistent poverty and economic stress within households. So you see that the issues of elder abuse, like in Malawi, do not happen in locations where, say, people are known to have money. In low density areas, you see that elder abuse is quite very common in poverty-stricken areas. So the entire elder abuse has got very serious phase when it comes to the poverty that people are going through. Harmful cultural beliefs and witchcraft related accusations. On this one, it is very serious. As I speak now, 15 other persons in Malawi have been killed from January to date on witchcraft-related accusations or harmful cultural practices. So there are a number of deeply embedded cultural practices which are contributing to elder abuse in Malawi. So as already alluded to, we continue to register a number of cases of elder abuse, even killings in Malawi coming from witchcraft-related accusations, cultural beliefs, etc. I must also put it on record that the Witchcraft Act in Malawi is very clear that witchcraft does not exist, and whoever calls someone a witch should be held accountable in our courts. So we, as I speak now, we are still operating based on the existing legal framework that is very clear: witchcraft does not exist. And then we have going further to the issues that are driving elder abuse. We have weak social support systems. Gone are the days where you would have family members providing the support systems that other persons would need in Malawi. Now, with the urban migration, HIV and AIDS has also wiped a generation, exposing other persons to isolation. And that isolation is contributing largely to issues of elder abuse. I must state quite very strongly that despite all these, you still continue, like in Malawi, to see that other persons are playing very critical roles in various spaces. I'll come back to that later. Gender inequality, particularly affecting older women. So I just said about 15 older persons have been killed in Malawi very recently from January to date. Out of the 15, 10 of them are older women. And that speaks about the gender face that elder abuse is taking in Malawi. Lack of awareness on other persons' rights. We continue to raise awareness. Various key stakeholders continue to raise awareness, but a lot more needs to be done. The theme is very clear: beyond awareness, what do we need to do to ensure that we are able to prevent elder abuse? And then inadequate reporting and response mechanisms, and the growing care burdens linked to disability, HIV/AIDS, dementia, non-communicable diseases. I think we need to go flat out and speak about dementia in Malawi. What is dementia? How does it affect everyone else, but especially older persons? And how many older persons have been subjected to abuse because of dementia? We need to put these things in a context and ensure that Malawians understand what dementia is. What are we doing as a country now, having realized elder abuse is a very serious and critical issue in Malawi? I must say we are advancing, but we have to be very careful as well whether what we are doing is contributing to the prevention that we are talking about now. Malawi has made very significant progress over the last decade in advancing the rights and well-being of older persons. Key interventions in terms of policy and legislative framework. Malawi has got the National Policy on Older Persons. Malawi has got the Older Persons Act 2024, which has all the key provisions required in order to create a conducive environment for older persons. Social protection, we have the cash transfer program in Malawi. Among the beneficiaries are older persons, and with money in their pockets, we are able to uplift the dignity of older persons across the areas where older persons are beneficiaries. Awareness and advocacy, there are national initiatives and campaigns all the time just to ensure that Malawians understand the rights of older persons. And what needs to be done to ensure that we join hands and provide the supportive mechanisms that we need for older persons across the country. Under health and care, there are growing conversations around health aging by WHO, which is quite very interesting, just to ensure that the health workers across the country understand some components of geriatric care and moving forward, what needs to be done to ensure that this is properly taken seriously across our health delivery systems in Malawi. The significance of the Older Persons Act, let me just briefly talk about it. It's a historical milestone in Malawi. For the first time, the rights of older persons are comprehensively recognized and protected through a dedicated legislation. The Act affirms the dignity, equality, and autonomy of older persons. The Act prohibits abuse, neglect, violence, exploitation, and discrimination. The Act creates legal obligations for the protection and promotion of older persons' rights. The Act strengthens accountability among duty bearers. The Act provides a framework for access to services and protection mechanisms. And finally, the Act aligns Malawi's legal framework with regional and international human rights commitments. In Africa, we are talking about the African Union Protocol on the Rights of Older Persons, which Malawi also ratified, quite very encouraging as well. And as I speak now, Malawi is also part of the global movement supporting the UN towards the UN Convention on the Rights of Older Persons, a global framework which is going to support creating an enabling environment for older persons across the globe, with Malawi inclusive. Now, beyond awareness, what must happen next as I conclude? If we are serious about making AIDS prevention work, 5 priorities are essential. And what are these? We should invest in prevention. We must address the root causes of abuse through various social protection mechanisms, poverty reduction initiatives, public education awareness, community support systems. We must strengthen reporting and response mechanisms. Second, older persons need safe, accessible, and age-friendly mechanisms for reporting abuse and obtaining justice. We have been crying already. Our justice system in Malawi is not doing us pride, because you would actually see that more older persons' cases are not being concluded the way everyone else would expect. Thirdly, building capacity. So police officers, health workers, social welfare officers, tradition leaders, judicial officers, and caregivers require specialized training on elder abuse prevention and response. Number 4, we must improve data and evidence. So what is not measured remains invisible. And I'll repeat, what is not measured remains invisible. We need stronger national data systems to understand the prevalence, the patterns, and the impacts of elder abuse in Malawi. For me, I've always said data is key. Where older persons are invisible, it becomes difficult to design programs meant to address their issues. And lastly, we should make a deliberate effort as a country to implement the Older Persons Act. So for me, the true test of any law is implementation. And I'll repeat, the true test of any law is implementation. Adequate financing, institutional arrangements, regulations, and accountability mechanisms are essential to translate legal protections into meaningful change. As I conclude, as we move beyond awareness, we must recognize that elder abuse is not inevitable, it is preventable. Every older person has the right to live free from violence, free from neglect, free from exploitation and discrimination. And for me, the measure of any society in the world is how we treat the less privileged people. The measure of any society in the world is not how we treat the powerful, but how we protect those who are vulnerable. Let us ensure that aging in Malawi and across the world is accompanied not by fear, not by exclusion, not by abuse, but aging should be accompanied by dignity, security, participation, and respect. Thank you for your attention.
Oh, thank you so much, Mr. Kavala. I think that is so comprehensive. You've given us a really good background and a good understanding in terms of facts and figures. Absolutely shocked. I think last time I checked the stats was a month ago. It was 11 people this year, and now it's already come up to 15 people this year who have been killed. And I know that in the last, I think since 2015, we've had over 300 older people killed. Just because of witchcraft or some culturally related outcome. But the key things that you've talked about, I want to pick up on, and I want my audience to think about, is that 1911 Act, that Witchcraft Act. We know that in 2021, the Malawian Law Commission tried to review this. It's been in discussion, but it is very, very controversial because the act doesn't recognize witchcraft, and yet people want witchcraft to be recognized. And the act criminalizes people who are accusing others of witchcraft. So it's very, very controversial, and it needs to be, I think people need to really dig into this a little bit more. It's been there since 1911. It is protecting our people, but it does need to have a reform. So there is something about, can we have a consultation around this as a country? But thank you so much. You've given us five nuggets. I'm holding on them onto them for later on because I want to give Ethel Gausi, and I hope we also have with us Mr. Gausi Gift. Ethel, is Gift here?
No.
Okay, okay, that's fine. So I'm just going to introduce you. Is that all right? Because I had both you and Gift as part of my introduction. Thank you so much. So in terms of action, that was one of the things that was highlighted about making a deliberate effort in implementing and in investing and strengthening and supporting our elders. I just want the audience to please warmly welcome Ethel Gausi, who is a co-founder with Gift Gausi, who's not with us today. And they are founders of the EGAF, which is Elderly Care Foundation. It is a community-based organization dedicated to protecting, supporting, and advocating for the rights and well-being of older people in Malawi. Ethel serves as the executive director of EGAF, and she also leads the organization's programs, partnerships, and daily operations, ensuring that vulnerable elderly people receive care, protection, and support. Through her compassionate leadership, EGAF provides food assistance, healthcare support, advocacy, and protection for older persons facing abuse, neglect, isolation, and discrimination. So both Ethel and Gift have devoted their lives to serving elderly people in Malawi. For over 4 years, they've worked tirelessly to support more than 135 older people and their families through their care programs, their community outreach, elderly rights advocacy, and awareness campaigns. I want to commend you, Ethel. I think you and Gift have to be commended because your vision is to establish a permanent elderly care center. You want to expand services throughout Malawi and create a society where every older person is valued, protected, and treated with dignity and respect. Ethel, ule mukwainu, itine naet ule mukumpando. I give you the floor.
No, thank you so much, Sarah. I really appreciate. I think you've already said a lot. I think let me also just go straight. So our work, we having feeding centers. We are also having a residential care, respite care, advocacy, and also safeguarding. We are having 3 feeding centers. We are having a feeding center in Mapas. There we are having about 40 older people. We are also having feeding center in Machinjiri, where there is also our residential home. There we always have a maximum of 15 older people due to our house being small, and so we make sure that the number should not exceed 15, but we allow those that have surrounded the area to come just to have a meal for each and every day. And we are also having a center in Bangwe. Bangwe is our biggest center because we are having about 68 older people. So that's about our feeding centers. Our residential care, it's in Machinjiri. It's a short stay because of the environment. Our wish is to have a permanent residential place so that we can be having them permanently. But for now, what we actually do is we make sure that when they come, we go to where they are coming from, because we don't just take any other person, but we look at the circumstances or the events that has surrounded that other person. For example, we had a case in Sanje whereby an older woman was almost bent. So we had to look at that situation. There was no one who could have taken in that woman. So we had to come in. We go to Sanje and take that person in. So we took her in. Those are some of the cases that we try so much to take the person in. So those that are at our residential place are only those that are having circumstances, more especially witchcraft accusations. We know that the community has not accepted them, we take them. So after we have taken them, we go back to their communities, because we are trying so much in our work of advocacy. We don't want to create a ridge between families, but we also want to help in a way of reconciliation, because before us, you have to understand that this person is having a family. So before us, there was a family that was looking after this person. It might be that something happened, so we don't want to be people that somebody will go like nale kanisa banja kapena ntundu kapena family ina yake. So we try our level best that we go back, we sit down, we teach them, and bakale kulolerana, there has to be reconciliation, then we send them back to the community. And chifukwa chake we also work kwambiri ndi mafumu, because ndamene samatithandizira kutiuza pakuti pali nkhani, this place there is this issue, there is this issue. So that's about our residential care. And we are also having respite care, whereby an example is the example that I first gave of that lady. We had to take her from Nsanje to bring her here. We also had an issue with Margaret. She's still with us. We rescued her because she was suffering abuse from her grandson about the land issues, to a level whereby they sold the land. When they sold that land, she said, I'm an older person, I have this money, go and keep it to your account. But the grandson ate the whole amount of money, 8 million Malawi kwacha. So in the process of her asking about the money, the grandson was so furious. He had to hit her to a level of removing Imanose Amusi up to now. So we said, no, we cannot allow this thing to continue happening, because in early abuse jodi imapitirirabe. So we had to take her in. And we are also having a case of Alice Diamond. She lost her husband and the kids along the way. So the community rose against her to say she's a witch. She has eaten the entire family, and she's not from where she was staying. So they said, like, you have to go back to where you came from. So she was like, I came here in 1973. I have never gone back home. Where do you think I'll start from? And I'm an older person. So those are the areas that we look at, and we are also much into advocacy. We are making sure that we are protecting the rights of the other people. We fight for their rights, dignity, well-being of them. And we are also much now into awareness campaigns whereby we want the entire world, the entire Malawi. People should know that being odd is not witchcraft. Azitha kumvesesa ndithu kunena kuti munthu akakula amene uja ndi chitsime chakuya chokuti we can learn a lot from that person. So we are in too much awareness. That's why even yesterday we went out to go and do kukaenda, since our theme it is for this year, it's beyond awareness. So it's not just a matter of talking. We had to go out there and to tell people, no, it's not just a matter of you saying, I love my grandma, but you have to show that you love your grandma. Have you greeted your grandma? Even here in this webinar, how many of us have we greeted our grandma? If we are having our grandmothers, our grandfathers, how many of us have we greeted them? How many of us have we checked on them? Not only our grandmas or our biological grandpas, but any other person that we have met. Did we greet them? Did we say hi? I remember growing up, we honored them so much, but nowadays you cannot see it. You see, even Oloana ambiri masiku ano amaganizidwa kupita kukaona agogo awo. So we are into awareness kuti people should understand kuti no, it's okay. Kodiru anthu andonena kunena kuti we were even showing some people yesterday because tinayambira pa Kamzu Stadium. So we were saying Mayona Stadium, the one that is behind us, Kamzu Stadium. Achikulira ena amene tili nawo apa anathandizira kuti stadium imeneja imangidwe. So are you telling me to say the time they were building that stadium anala fiti, so ufiti ukugwera lero chifukwa chani akalamba? But we are using that stadium. Those are the people that they've gone before us. Before us, they were those people. They've raised us. For us to be here, it's because of them. So we are in too much awareness campaigns, and we are also combating witchcraft accusations. We are much into challenging harmful beliefs that lead to violence and discrimination against other people, and we are also responding to abuse cases. We intervene in cases of abuse. Tima SS and it, once we hear what someone is doing hazard to an older person, we rush mpaka na tikaone what's going on. Tayanja nitse zitegepo, and we are also much into community engagement. That is why that time we even had inkosi yamakosi Goman, because we are in too much ma communities, because nkhazazi zimayambira ma communities and ma enablers iso ankhazazi timakhala so ife anthu ma communities, because timakhala chete wachikulire akamachitidwa nkhaza isa abale anga. So we are in too much community engagement, because timazowa kunena kuti tikakhala bwino m'madera mwathu will be able kunena kuti wina athe kunena kuti akomatu apa kuchitika nkhaza. So we are taking action and promoting dignity and inclusion for the other people. So basically, that's what we are doing in our advocacy, and we are also safeguarding, making sure that we are cooperating with the police, legal organizations, hospitals, social services, Malawi Human Rights Commission, even MANEPO, so that we in this work we can all safeguard and make sure kuti pali relationship yabwino, all of us tisamaopane koma zinthu ziziyenda bwino. And we also promoted awareness imene imachitika dzulo ya World Elder Abuse Awareness Day. We had to go to my churches. We are also engaging my churches. We had to go to Assemblies of God, to Bishop Suya. We went there. We also organized a visit for Ngwenya Mainkos Yamakos Gomani. He visited, and his message was powerful. Aliesa anamvetsetsa chimachokera kwa mtu wankulu. So aliesa anamvetsetsa kuti akodidi achikulire ndofunika. Komanso tinapanga now, we made sure that we completed started a 5 days caregivers training provided by St. John's so that we are able to handle these older people. We know because we've had my incidences whereby somebody had dementia, but we were not aware. We saw the signs, but because we were not aware, we did not help the person earlier. So before we can go to the hospital, us, we can also help the person. Kumayambiriro, and we also organized the walk that was yesterday. It was beautiful, it was successful, and now we are making sure that we make sure that every district there has to be an awareness. Yonena kuti anthu aziziwa mamizi mutifikiremo, they should know that it's very important kusamala achikulire. And currently the challenges that we are encountering in the funding, we want shelter feeding centers mokuti chifukwa mostly timapezeka kuti timakhala pasi pa mtengo. We are sitting under the trees and mostly zakudya zimapezeka it's being blown by doti kukakhala mvula kumanyowa ndachikulire because we have no any a place that we can keep them, accommodation and bedding facilities. But it is it akukhala ndambiri nkumathandizira pati pamenepo ma transport timaenda pasi maulendo atali kunena kuti sitikuyenera zizitero, but because we are so passionate about it ndeti mapezeka kuti we are still going. And there is also stigma and resistance. Anthu amapanga resist kwambiri chifukwa amangokhulupirira kuti ayi anthu ndafiti basi. No matter how we try to tell them, ambiri amapezeka kunena kuti they are still resisting what we are trying to, but still more we are forging ahead, and our way forward is to make sure kunena kuti we establish a permanent home for the older people. We should build something that we can live all in peace, dignity and harmony while receiving proper care and support. And we also want to expand EGAF across Malawi. We want to extend our services and advocacy work throughout the country so that more communities know about EGAF and the challenges facing older people. And we also strengthen advocacy and awareness. We will continue educating communities about the rights of older people and addressing issues such as abuse, neglect, discrimination and witchcraft accusations, and build a network of older rights champions. We aim to rise and empower more individuals, community leaders and volunteers to protect and promote the rights and the well-being of older people, improve care and support services. And we also plan to enhance access food, healthcare, shelter and other essential services to ensure older people live healthy and dignified lives, creating sustainable programs. Tiliso ndi program yoti timapuzitsa kusoka azimayi amene ndi ma single mothers, ma widows koma kusamalira achikulire. We want to empower them because kuwathandiza sokwina beyond awareness is empowering those that are close to the older people, because nkhaza zina zimabwera chifukwa chonena kuti munthu amene akumusamalira caregiver doesn't have anything. Ndenkhani makhala risono ndikuzelepera kuzidyesa ndenda adyetsaso bwanji awo. Nkhaza zina zimabwera pamenepo. That's why ife ngati EGAF tinanena kuti okay, no, isangokhala nkhani yonena kuti shouldn't not be about kumango yankhula, but action of taking this one, the caregiver timpatse chochita, then caregiver yazitha kuwasamalira bwino. And we also seek to strengthen our farming and income generating activities. Timalima currently tili ndi nthochi. We are also having onions, penaso chimanga, just for us to be sustained, kunena kuti tipitirize ndithu kuthandiza achikulire osiyana-siyana. So in my conclusion, all I can say is beyond awareness, we must move from talking to action, because action speaks louder than words. Thank you so much. I really appreciate for the opportunity. Thank you so much.
Ethel, thank you so much. I mean, your passion is emanating through the screen. Ndikuchita kuona kuti you have this desire, this willingness to support the elderly in your community, and I can feel it. I know our audience feels it. And thank you so much for all that you're doing in the community, and standing in the gap. You know, the things that you've talked about, we can say it's very multi-pronged. You are going in there, you are doing the basics, making sure you're feeding them, providing shelter, looking after their health, but looking after them as a whole person as well. And that's also thinking about how do we look after them spiritually, and beyond that, how do we empower them so that they then become independent, and also going back to the community, because we are a community entity, they have to go back into those communities. How are you sensitizing those communities and ensuring you're engaging with key leaders? I think it's not just our form, you've gone beyond our form. You're going into policy, you're going into governance, you are engaging with the police, you're doing so much. I think one of my biggest questions later on will be, how are you managing? What support are you getting? Where is this all coming from? Because all of this has to mean that somebody's sacrificing somewhere. Goma, thank you so much for
And
the work
so,
that you're doing.
sorry to go to disturb your flow as well, but what
Yeah.
I liked about your presentation, you also focusing on sustainability. How
Mhm.
do we sustain this going forward? And you've got some plans. I think that's really key
Mm.
because and that's what the funders will always ask. If we don't do something quick and then leave people to suffer, but how will they sustain themselves? So you're doing the sowing, growing vegetables, growing all sorts of things. So
Mm.
that's really good. But anyway, over to you, Salah. But I just thought I should step in. You know me.
No, yeah, I know, Charity. We'll give you an opportunity later on. Goma, thank you so much, Ethel. I think I just want to move us on to our next speaker, um, the lady who Anatito Saifeedi, who encouraged us that can we please do this? Can we please let me. I'm trying to do a couple of things at the same time. Can we please have a session around elder abuse and awareness? And she's one of our own, based up on this side of the waters. I just want to introduce Didziwe Malinki, who is a registered nurse, and she currently works as an adult nursing lecturer in Cardiff University in Wales. And her main focus is on care of older adults, including those living with dementia. And she is also a founder and coordinator of the Enrich Malawi group. Tidziwe, speak to us because I know you have a lot that you want to say. So I don't want to take any more time. I'll leave the floor to you. Dakula Ndilani.
Oh, thank you so much. And thank you so much to everyone who has spared their time tonight to come and speak to us. So I'm not as fluent as Ethel and Mr. Kavala are. So I'm going to use some slides to guide my talk. You can actually tell that I'm a teacher. So here we go. I hope you'll be able to see my slides. Can you see my slides?
Yes, it's coming
Okay.
through. You just need to put it in slideshow mode. Brilliant.
Thought I was. Okay. So, what I'm doing tonight is actually reflecting on the World Elder Abuse Awareness Day, which happened yesterday, and most of us did take part. And I think you've seen a lot of pictures on Facebook and on some WhatsApp pages as well. And as we said, the theme for this year, Beyond Awareness, making elder abuse prevention work. And sorry. My reflection is mainly on what we can do as a team to prevent elder abuse. So I'm actually looking at actions like raising awareness, caregiver training, early identification, whistleblowing, regulation or monitoring services, combating isolation, elder isolation, carer support, and empowering um, elders to speak up. So those are the areas I'm focusing on or reflecting on. I'll give you a very good practical example of how we can move beyond just speaking about elder abuse, but doing something about it as individuals, as a community. And allow me to introduce Enrich Malawi. And I'm so proud of this baby, to be quite honest. It's a growing baby now. It's not maybe I can say it's a toddler. It used to be a baby a few years ago, but now we are growing. Very proud of the members, very proud of what we've achieved. And it's a typical example, very practical example of what we can achieve together and how we can go beyond elder abuse. So who are Enrich Malawi? Because people usually say, who are you? So we are a group of women. And initially, we used to be a group of Malawian women, but now it's a group of any woman. Any woman can join the group as long as they are resident in any part of the UK. And joining this group is voluntary, so anyone who wishes to be part of it, they are welcome. But the only criteria is they have to be passionate about care of the older adults, and they must be passionate about charity work as well, because it is very demanding. It is very hard. It's not an easy job at all. So our work, this group was founded in 2024 with the main aim of generating funds to support organizations like EGAF, people that take in older persons who are at risk of abuse. We weren't only interested in those that just need care, but we were mainly looking at those adults that were being abused or were being rejected from their communities, or they were being badly treated. So we were interested in supporting those people. But because we could not do that directly to those people, we decided to go through organizations in Malawi like Mbambande Foundation as well as EGAF. So how do we work? Usually people say, oh, we don't have money, we don't have a grant, we don't have this big donation to start this piece of work. But what did we do? We just decided, okay, let's form this group. I had this little idea and thought, if we contribute £5 each every month, which individually you would think £5, what is that? It won't go far. But when you do things together, so my theme tonight is always working together as a group, because I've learned through my years that if I work alone, I'm not going to achieve anything. But working as a group, you do achieve a lot. You do conquer the world. So what we do as well, because the £5 a month goes towards main projects, but we also fundraise. I'm such a good beggar. I ask for money, especially when it's for a good cause. I'm not shy at all. I'll approach people, my colleagues in work, people in church, my neighbors. I think my neighbors see me, they run, because they know if I've got a piece of paper in my hand that I'm going to ask for a donation. But fortunately, because of the rapport I've built with people, they do give me the money. They do respond to me. They do understand why I'm doing what I do. And it's just making people aware how important the job that we are doing is, then people work with us. And as I said, the funds that we raise, we pick projects that we work on, and sometimes we help with ad hoc needs as well. So what have we achieved? This part is literally like showing off what have we done, because I feel it's so amazing. So in the first year, we worked with the Mbambande Foundation. I think most of you know this foundation. It's an elderly care foundation in Lilongwe, which maybe accommodates about over 70 elderly adults. Unfortunately, I couldn't get Mbambande to join today, otherwise it would have been too many people in one webinar. But at some point, we'll engage her as well to come and speak to us. So in this first year, all we did, because we were developing, the group was slowly growing, and we started off with 15 members, and as of today, we are 53 members, and I'm proud to say I'm so proud of the girls. They are really doing a massive job. And we've got some regular sponsors as well, because the husbands of the women who can nag, they also sponsor us, because they can't join the group because they are not women, but their husband gives us regular support as our regular sponsors. So in this first year, we managed to raise just over 8 million Malawian kwaches, and this money went towards food for the elderly people at Mbambande Foundation. Then in the second year, we thought, why don't we do something that we can actually measure the impact of what we do? So what we did was we did a massive fundraising event, and we raised enough money that we developed a wellness center for the people at Mainbambande Foundation. And we purchased all the equipment that they needed to set up this facility. And we also designed, I myself did all the paperwork for this institution, helped by Cynthia Kennara. She was really instrumental in helping me do this work. And then when you look at one of the objectives on how we can prevent all the activities, how we can prevent elder abuse is through regulation and monitoring. These institutions, because we always say, oh, abuse happens at home or abuse happens in the community, but abuse can also happen in the institutions that people are being cared for. So what we are doing is make sure that these institutions are regulated, they are inspected to make sure that the standards that are being delivered are appropriate as well as adequate. So making sure that people are being looked after the way that they're expected, not removing them from fire and entering another fire, just a different type of fire. So just making sure that wherever they are safe enough. So we've helped them to do the registration with the Nursing and Midwifery Council of Malawi. And that was a long process. It's taken us about 6 months, but we finally achieved it and they've got their registration now, so they are legit. And then people usually ask me, what's a wellness center? So that's, I don't know if you can read that or I can read it out. I'll just move that away a little bit. To define what a wellness center is, because people always think a wellness center is a clinic, but it's different from a clinic. So it is a facility which focuses on improving an individual's physical, emotional, spiritual, and social health and well-being, addressing causes of health issues, promoting long-term well-being, and enhancing quality of life and preventing illness achieved through the provision of integrated services. So you can see a lot of key things in that definition, what we are trying to achieve, which I'll talk about in the next slide. And the key component is the services are mainly preventive and promotive, but not curative, because anyone can run a wellness center. We don't need people who are trained, who are qualified to run this center. So the services that we established at Mainbambande were routine health checks, including blood pressure and other vital signs, blood glucose monitoring, weights and height, and some older people sessions, and these were geared towards prevention of frailty in older adults. And these included exercise classes, health education, nutrition programs, and social activities, just to make sure that we are combating that isolation, we are preventing that social isolation by making sure that people are doing activities together. And because we had some space and capacity, we also incorporated some under 10 children sessions, just because in that village we were informed by the chiefs that there were a lot of deaths from malnutrition of children, and there was really poor uptake of vaccine. So we thought, okay, we've got an existing service here. We can squeeze in something else and use that as a point of contact because of the aims that are at the bottom there, which I'll explain to you. So we thought we could use that first objective of early identification and referral, so that when the children come in, we can see who is not looking well, who is looking isolated, who is looking sad, and then maybe probe further and then identify them as at risk and refer them to the appropriate services. And in Malawi, I think most of you can agree, hypertension and diabetes are on the rise. And we thought by simple monitoring mechanisms like regular blood pressure checks and blood sugar monitoring, people can identify these two conditions early and send them to the hospital before they are worse or before people are literally collapsing. So that was our main aim. But we also wanted to reduce reliance on acute healthcare services because people always rush to the hospital. They just need a blood pressure check, and then they go into a very busy hospital. So we are trying to ease that pressure by just making sure that we can do something at home before we rush into the hospital. And as I said before, prevention of frailty in older people through good nutrition, social activities, and exercise, and also health promotion through health education, social engagement through social interaction of the older adults and other people as well within the center, and fostering community engagement by speaking to people around the village because they do come into the center to have their blood pressures monitored, not just people at the foundation. So this was a very good initiative, the first one of its kind in Malawi. We are hoping, as Mr. Kavala has said, that we'll get some data out of there to see the impact of this service, to see what we've done, how many referrals, how many people have we identified and helped, just to measure that and see if it works. Then we can continue implementing it in different centers across Malawi as a model of care. And now we are in year 3, and we've now moved on from Maimbambande because we think we've achieved what we wanted to achieve there, and we are now working with EGAF Elderly Care. And because, as you heard, Ethel, they do quite a lot, and we couldn't do all that with our little group. But what we've decided is to pick one component that is the biggest need of shelter. As you can see, she only houses 15 older adults and on a very temporary basis. But if she had more room, she could take on more people, or she could take these people on a longer term, because having a chat with her and gift one day, they had to go give back, maybe discharge some of the older people back into the community where that risk was still existing. And so that is not on. We have to make sure that we discharge people to the communities back into their homes when that issue that we took them out from is fully resolved. So at the moment, they are facing that challenge. So we are in the process of raising money to buy them a piece of land. It sounds like we are so rich, but it's actually doable. So as of today, we've raised up to 3 million. We are looking to raise up to 5 million to buy a piece of land that we've identified, and then we'll start the development. So we've committed a year to EGAF. And within that year, by the time we leave, we're hoping that we would have built on that land that we've given them a multi-purpose hall that they can start using. Instead of eating from under the tree, they can actually sit under a nice shelter, and then we'll hand it over to them to continue developing the place themselves at their own pace. But at least they will have the first structure. So that is our aim for this year. And we are also supporting EGAF by providing them with some food and some other items. We sent 3 drums, 2 of food items and 1 containing clothes, which have arrived this week, and they should be receiving them anytime. So that is just to help them with some ad hoc needs, which the group is doing. And we've also, which I'm very proud of, we've offered them training, which Ethel talked about. So that's combating that lack of training, knowledge and skills in carers. So we've trained Ethel and Gift and 1 nurse from MANEPO. We send them to St. John's Ambulance, and they've received a certified carers course, and it was a 5-day course as well. Very, very good intensive course, which has equipped them with the right knowledge and skill to look after these elderly people. So I'm really proud, and thanks so much to the gang in Enrich Malawi for this achievement. It's fantastic. We're just waiting for the certificates so we can show them off on social media. And because the group is so full of nurses as well, it's not like maybe half of the group are nurses. What we do is if people like EGAF and Maimbambande are stuck, we are able to offer them expert nursing advice in terms of how do they look after elderly people like myself who are experts in elderly care. So that is what we are doing this year. So in a nutshell, I was reflecting on how we've met the World Elder Abuse Awareness Day theme for this year. So we have shared awareness messages through webinars like this one, and we've done a podcast as well jointly with Muna. We've sponsored activities like Ethel said that Nkosi Amakosi visited them. We sponsored that visit, and we fully sponsored the walk that happened yesterday as well. So as a group, we are achieving quite a lot. And we also funded the training, the 5-day carers training, and we've done fundraising activities. I think most of you have seen me selling these satin ribbons, and I'm making a bit of money, which is funding all these activities. And a few members as well have joined me in raising more extra funds to make sure that we are meeting our objectives. And we've also paid for some media coverage with Times Malawi and Ted Kwelepeta, and there's someone else for photography and videos, just to make sure that that media presence is spreading more and more awareness messages out there and making sure that we are posting and reposting. I think my whole WhatsApp and Facebook pages are full of charity work. I think it's not personal anymore. We've got a Facebook page as well for Enrich Malawi, which is helping to spread these awareness messages. And of course, we are wearing paper. By wearing paper, it shows that you are standing firm in solidarity in prevention of elder abuse. And what do we do next? We're going to continue fundraising, working as a group, and because we are getting more and more ambitious, I'm looking at recruiting more members. So if anyone in this group, in this chat is interested, or you know anyone who is interested to join us, please contact me. And we also aim to work collaboratively with Muna, MANEPO, EGAF, and other charities, and Malawi Human Rights Commission, to make sure that we are working together to combat elder abuse everywhere that we are. And how can you help as an individual? I think most of you have seen that poster that we usually send. It just asks you for a donation. If you can donate something little that doesn't come to Enrich, but it goes to these charities through us. So if you're able, please contact us. And if you need the flyer, we are able to send you through Sarah and Charity to make sure that we are raising enough funds to support the charities that are doing a lot of work. And I'm going to conclude with just a few key messages. Firstly, as we say, collaboration is so key. Together, we can achieve a lot. As you can see how we've achieved so much by just working as a group. We haven't got a big grant, but the same little money, we are going so far. There is an African proverb that my daughter has taught me. It says, if you want to go fast, go alone. But if you want to go further, go together. So I really, really love that, because I feel it does make sense. And we just have to remember that prevention of elder abuse is everyone's responsibility, not just those caring for older people, but everyone, starting from the family. As I talked about whistleblowing, if you identify that someone's at risk, please talk. If you are someone being abused, please talk. Make sure that it stops. It's not going to be right by not talking about it. Burying our heads in the sand is not going to help. And to achieve effective results, preventive actions must go beyond just talking, just raising awareness, but actually doing. Our actions must speak louder, as Ethel said. And my personal quote that I usually like what drives me to do the work that I do is I want to say, if when it's all over, I'm asked, what did I do with my life? I want to be able to say, I offered love. Thank you so much for giving me this chance to talk. And I will hand it over to you. I'll stop sharing now.
Thank you. Thank you so much, Tidziwe.
You're welcome.
Truly appreciate that. Just showcasing how you have identified organizations that are doing their bit back home and supporting them. So it's looking at who are the people on the ground and how do we support the people who are already doing things instead of, we don't need to recreate the process. Ethel is doing fantastic work. My Mbamba is doing fantastic work. Manepo is tapping into things. We don't need to recreate that, but we need to be able to support what people like Ethel are doing on the ground.
Yeah.
Now, before I take us into the Q&A session, I want to give Charity about 5 minutes because I know she's boiling with thoughts in her head, just to sort of pull together all the bits and pieces from what everybody has been sharing and just sum that up for us and give people an opportunity to just think about questions that they ask so that we can have a discussion. Charity, can I give you 5 minutes? You need to unmute.
Yeah, so I won't take all the 5 minutes because I want
Okay.
to give our audience quite some time, but it's been really
It's a
impactful.
spotlight.
Yeah, it's been really impactful from starting from Andrew. Unfortunately, Judge and Taba couldn't join us because of network issues this evening. However, Andrew did set the scene in terms of mentioning the acts, mentioning the UN Convention, all the right acts, the policies that are already there, the framework that's already there that we need to try and use. But also what was really profound from your talk, Andrew, was the mentioning of isolation and what isolation can do in terms of abuse, but also the impact that it has on our elderly. And it's really sad to think that our elderly population are isolated in Malawi because it's not our culture. Our culture, people look out for each other. And I think it's been like that for a while. There is a concept of Ubuntu. Ubuntu is in your community. If somebody dies in a village, let's say those days, if somebody dies and none of you knew, Mfumu will sit and probably give you a very good talking because it's like we failed them. Why are we doing this to our elders? Why should we fail them? And I also reflected on Ethel. You mentioned this as a metaphor to say, look at the stadium. Probably some of these built it. We are standing on the giants. We are standing on the shoulders of the giants. We're here today. All of you, all of us here on a call are here today because of the sacrifices that those that are gone and those that are old now that we look at have put in place for us to be here to sit and advocate, to sit and talk through these Teams or Zoom. It's because of them. So there's something about to have that respect. Oh, gender inequality. Why did you bring that, Mr. Kavala? Because I think that's a fight, man. God. So you said that 15 elderly people have died. I wasn't sure whether it was from this year, from January to June 2026. And that's 15 is just too many. And out of the 15, here, out of the 15, 10 were women. Whoa. That's another level. What are we doing? What are we doing? What's the community come up to? How did we get there? You spoke about the health aging components, geriatric care, dementia. You spoke very clearly about prevention, capacity building, data, and evidence. But you know what? We Malawians, people come to Malawi to do their PhDs, to write papers. They take data from us. We've got rich data. We have to use it as evidence. Oh my God, Ethel, I was really touched when you spoke about the work that you're doing in sitting under a tree, the need for beddings, but also to think of the stigma that's attached to this. And most importantly, to go beyond awareness. We have to go beyond that. We need to stop talking. We have to act. And I think it's a call to action to all of us here on a call, but also tell your friends, your neighbors, your sisters, your cousin. It's a call to action. We have sooner or later it's going to be us, sooner or later, and we are all going to age differently depending on the environment, on our genetic makeup, and we want to be looked after. God forbid, some of us are going to be very difficult people, trust me. And and I want to be one of those. Yeah, and Titsiwe, just want to thank you so much for the work that you're doing, reaching out to our community, supporting in a small way, in a little way, but very impactful, picking up my Mbambante, EGAF. You've now introduced me to Mr. Kavala Manepo. So there's so many ways that we can contribute, but I don't want to take a lot of time. As I said, Salah, over to you. I did put a question which came to my inbox in the chat. I don't know if I've done it justice, but it's for you, Salah, to moderate.
Yeah, thank you. Thank you, Charity. I think I'm actually going to read that question out and I'll open it to all Ethel, Tidziwe, and Mr. Kavala. And the question is that in the NHS, so that's here in our healthcare system in the UK, they're moving care from the hospitals into the community and trying to keep people in their homes, which you are doing really well, and something that Ethel articulated and Malawi's done really well. The question is, what should Malawi do to keep our elders in the communities or closer to communities? And how is the concept of nursing homes received? Because we are community people, right? So nursing homes is taking them out and putting them somewhere else. And how can we reach those undeserved communities in Malawi? I know it's 3 questions, and I'll let you answer the one that you want out of those 3. I'll go to you, Mr. Kavala, first, because yeah, we heard from you at the very beginning. It would be good to hear your voice again. Are you all right to unmute? Has he frozen? Okay, I think Mr.
Can you hear me?
Kavala, okay, we can hear you. Yes, go ahead.
Okay. No, thank you so much. Yeah, indeed, I think those are pertinent questions. We've lived in a country where we cherish community support, family support, and now speaking about moving older persons to homes is something that is alien to the Malawian society. But however, Malawians should understand that things are changing now. In my presentation, I spoke about the urban migration that people have embarked on. So you see that you go into the communities now, you find that those who are supposed to provide care have moved out of the communities in search of greener pastures. So the communities now, you realize that the community support, the family support that was supposed to be there now are no longer there. That's the first thing. And second thing, we are also talking about providing comprehensive care. And this comprehensive care is not available at the community, as it were. I will tell you something. WHO Health Aging speaks about initiatives that would keep functional ability for older persons. And in most cases, these services cannot be found in the communities as we would want them to be. So I think the world is changing, and it's high time we embrace the new developments that are taking place. Thanks to Ethel. Ethel, well done. That was very inspiring. Actually, I was crying. I had to put my video off because when you spoke, you touched me. Well done. And thanks to my Mbambanda, I keep talking to her all the time. We need more of these initiatives in place. Just today, I got a call from the Queen Elizabeth Central Hospital. The director called me and told me they have a patient, 70 years old. They have just amputated his leg because of cancer or something else. But his 5 children have refused to come and look after him in hospital. So he is alone on the hospital bed after amputating his leg. And the director was asking me, Andrew, what can we do when he's discharged? How is he going to go home? And what situation is he going to meet home? These are the cases I want you to understand that we can no longer live what we've been living. These are the cases we want to embrace. Take these people into our facilities, provide the care that we can manage. At the same time, we reconcile them with the community. I like that concept from Ethel. Yes, there are some that we would keep permanently in our homes, like the residential home that MANEPO has constructed in Blantyre. There are some we are going to keep in the home as long as they want, the kind of residential homes in Europe. But at the same time, we also have reserved some rooms where we have those coming on short stay. So these are the cases we want to embrace. When somebody's life is at a risk, we move them into the home, provide what we can, at the same time reconcile them with the community so they can go back. So I wanted to emphasize things have changed, not just in Malawi, in Africa, and we cannot continue to let other persons live what we are assuming they get the support when the support is not there. I will stop there. I know Efro is burning to speak more than I would, but the point is we should move with the new developments that are taking place. Thank you.
Yes, Ethel, I think Mr. Kavala has passed the baton on to you.
No, thank you so much, Mr. Kavala. I really appreciate. I think you've tackled it so well. It's we are still having a bit of a challenge because it's like a new concept. I think of nursing homes. Like we would have some older people. Then when we take them in, they'll be like, maybe they'll be happy the first 2 days. Then after the honeymoon phase is gone, they'll be like, I want my children. I want to see this one. I want to see this one. I want to see this one, because it's a new concept. But after some time, you see them, they are now settling in. By the time we've resolved their case, they are like, no, I want to stay. I love it here, because there is still that stigma whereby other people, maybe they've faced trauma, so they feel like they are so closed in, whereby they feel like maybe everyone will abuse me. So when we take them in, after some time, you see them that now they are adjusting, they don't want to go anymore. We are like, but we've resolved your issue. You can know. That's why our way forward, we really want to have EGAF expanded, like in every district, in those undeserving communities. We should also have homes that older people can come and live there. They be with their friends, because sometimes I've also noticed through experience that mostly they are lonely people. Mostly they don't like to talk, because when they talk, we go like, "Komandero simukukalamba bwino," things like those ones. Inu kukalamba kwanu ndemutivuta nako simukukalamba bwino, like those ones. So they feel like, I think when I talk, I'll be judged. I would rather keep quiet, because when I talk, I'll be seen as someone who is so difficult. So that's why we want to expand it, that almost in every district, we must have a nursing home where every other person should feel loved, appreciated, They should know. That is why sometimes it's very sad to us to say we are still lacking like beddings and enough place that we can keep them, because we actually want them that when they come to the nursing home, they should feel that I'm loved. They should forget each and everything that they encountered, because I remember Nimarirabe up to now, we had a case of a certain lady. Unfortunately, we lost her. Anachitidwa nkhanza zoopsa zokuti even her grandkids amatenga chitengo ndikumalowesa kumalo kobisika, and telling her, when are you dying? Ufa liti iwe fit. And she was buried as a dog, that woman. We lost her just like that. And I was like, only if we had enough nursing homes, this woman, she did not deserve to die like that. She was supposed to live with her dignity, but there was no dignity. Even the burial, there was no dignity. So we are getting there, and people are embracing it. Sometimes when we go to villages, they'll be like, no, awawa atengeni, things like those ones. Kuno so mufike, like timalandira ma requests osiyana kodi kuno mubwera liti mutiikireso kuno achikulire. We even had a fruitful talk with Inkosi Gomani. We were even telling him to say, no, even in Cheo, we want to put a nursing home there, so that at least our older adults, they should be at a place whereby they are protected, where they are loved. They should feel to say, no, I think I'm loved, everything is okay, everything is fine, and I'm just like everyone else. So we just want to expand EGAF everywhere, that we should have nursing homes, and we are getting there. Thank you so much.
Oh, thank you, Ethel. I think one of the key things that's coming up from what you're saying is around safety, psychologically, the elderly feeling psychologically safe, so that they can be themselves. And thinking about where can they go, because kwao pakhomwe akumatseka pakama okanika kumasuka akufuna pamalo pokuti azimasuka zitakasuka eti kuti atha kukhala, they can be themselves. And I know that in
Exactly.
I'm not comparing, but here in the UK, we do have community centers. So in the day, you know, the elder people who live with their families, they come in the day, have breakfast, have lunch, and then they go home, just so that they can have that community with other older people. So there is something about community of their own. Kuti akula zikhala pasi aziyankhula amene akufuna yankhula aseke. If we've seen cases then akukwatira in their 70s, takutengana kumakwatirana, you know, that it doesn't mean that life stops, that but life continues. So I just wanted to pick on that very pertinent point. It's about being safe and having a community. Tidziwe, did you want to comment on that, the question that was asked around the concept of nursing homes and how can we reach the undeserved communities in Malawi?
Yeah, I'll just say something so briefly to say what we need is culturally sensitive actions, because we had this conversation with Ethel, because I always dream, and I said, if someone gave me a lot of money, what would I want to do? What I would want to do is each district of Malawi to have their own center, because what we are doing is we are not removing people from their norm. We are leaving them closer to where they are, because we were using the example of the lady from Nsanje. You remove her all the way from Nsanje to Blantyre, that's far away from home. It does create that insecurity in that older adult. So trying to keep them within that community is better. And also, if people are being looked after within their communities, there is that closeness, that love, because they are looking after their own, because it's within their own. So I thought that type, that if we have these centers within each district, it will be nice and intimate within there. And talking about this new nursing home that Mr. Kavara has introduced, this is like a proper nursing home, not a charitable organization, but it's where people are actually, you have skilled and trained staff. So you have to remember that as people age, as people get more conditions like dementia, their care needs become more complex, and you need beyond just a carer in the home. You need more trained staff now to look after this older person, because sometimes, like we talked about, unwillful neglect and abuse, it happens when people have got no adequate knowledge and skill to look after someone. So we have to make sure that we remove that stigma of nursing homes. We support people not to feel guilty that, oh, I've failed. It happens here in the UK as well. I sit with families where they're thinking, oh, I've failed my mom. Why am I putting them in the nursing home? But you have to make them understand that this is now beyond you. You've tried. Put them where they're safe, where they can manage appropriately, and visit every day. So you take away that strain, and you still have that time to have quality time with your mother instead of trying to push them to do something and yourself being strained. Then people do understand. Yeah.
Yeah. Thank you, Tidziwe. Actually, you've eaten part of my next question because I was going to ask about what practical actions can make the greatest difference. So thinking beyond raising awareness, what specific actions should families, communities, organizations, government take to prevent elder abuse and support our vulnerable older people? I will throw this out to you, Charity, first, because you could probably give us an insight from this side before our colleagues in Malawi answer.
Oh, you're muted.
Oh, sorry, Sarah.
Yeah.
What practical actions did you say?
Yes, what practical actions can make the greatest difference?
So first of all, I think we need to have we've got the act, we've got the law. We need to have the right policies in place, and the key is education for me. So education, not just at university, but starting from primary school, from when kids are kids, so that they should have that basic understanding of aging and what aging comes up with. I'll call out my brother then when we were very little. I remember him talking to my granddad that, oh, I don't like your hair. It's white. And I was thinking, God, now his hair is white. But just that's the aging process. The skin will change, the hair changes, they're not as fast as they walked. Probably sometimes they become forgetful. But just to have that basic understanding, and then going to universities, for us, we as we've said this before, we didn't learn about dementia. Tidziwe, you know very well, we didn't learn about dementia. It just wasn't part and parcel of any topic, maybe a little bit in psychiatric, but not quite, to be honest. So I think we need to invest in education, but also when it comes to this campaign that EGAF, MANEPO are doing is to enrich those vulnerable communities, those hard to reach communities, because that's where not only them, but also that's where they need that education when it comes to witchcraft to understand, because you might know about the 15 that have been killed because that you've been cited on those, but you don't know how many have really been buried alive in the villages because the singanga says I'm fit in the hour because azibalia ata asaoka, so I think there's need to really sensitize and to educate. But also, Tidziwe, I like your point when you said about the cultural sensitive. I think we need to be culturally sensitive when raising these issues as well.
Thank you,
Thank
Charity.
you.
I'm going to go to Ethel because Ethel talked about reaching churches. There was something about going into those communities. So can you just expand a little bit more? I know you're taking lots of actions, but could you give me some practical actions that kuti ifeyo unokozimene kuchita ku EGAF ndi zimene zikugwira? What are those things, and that would help you continue to support our elderly?
The first thing that we are doing as EGAF, with our motto that says it starts with me.
Hmm.
Normally, because these cases that we are having, it starts in our houses. Like, what are we feeding our kids? Because most of the times we've had cases whereby you hear a small child calling an older person, "You are a witch. My mom told me that you are a witch." Things like those ones. So we as EGAF, we are always saying it starts with me. What am I doing? What am I telling my kids? Because as I already said, you would understand that most of our generation right now, we don't even allow our kids to go to their grandparents as the way we used to go. Many of us, we are so afraid of going back to our villages to say, "No, I'll die, I will not come back." You see, those type of things. So it starts with me. What am I saying? What am I doing? That's why now we are going even up to churches, because everyone is found in a certain church. So we've made it a point of saying, no, let's visit churches. That's why we are on a campaign whereby very soon we'll also go to another big church. They've confirmed with us that we can actually go. And we are also teaching them about dementia, because the greatest challenge that we have now is dementia. But people are not aware that there is a disease called dementia. Mostly, we had a case with a certain lady. The day she died, we ate, everything was okay under that tree. We were okay. Then along the way, she was like, "Where am I?" Like she would, it was like she was grasping for air. "Where am I?" And some other people there were saying, "Oh, so you are even mukutamba masana ngati pano mwazizimuka kutayani pano," things like those ones. It means ndi zinthu zoti zinakazikika, but we were not aware that dementia was even involved. Guess what happened? A day after, we lost her. Only if we knew that dementia was involved, at least she could have been helped so easily, because she was forgetting where she was. So we are also educating churches, our community. Sometimes we also call people in our community, those that are looking after older adults. We call them to come. We are also working so much with chiefs. Sometimes we ask them when there is an opportunity to misonkhano tichatimachitika afumu aitana, we humble ourselves, we go to those places just to raise that issue. Kunena kuti no, there is a sickness called dementia. When you see them, instead of going to south, they are going to north. It's not like they are witches. So for us as EGAF, that is what is working for us, that we are teaching our communities. We are also marching to churches, because we know that if we cannot find them in their houses, we will find them at a church where they go to. So we are trying our level best by engaging with churches as well. So I think for now, that's what I can say.
Thank you
Fala,
so
there's some
much.
questions in the chat as well.
I have seen.
Okay.
Tidziwe, can I just address the questions in the chat before I come to you? Is
Well,
that all
I
right?
was just adding what Ethel was saying, to say
Yeah?
Nikos has also invited EGAF to use his platform when he has meetings. They'll give
Brilliant.
them like 5 or 10 minutes to speak about elder abuse, older people's care, and dementia care as well.
Thank you. Thank you for sharing that. It's important to have access to key platforms to share the work that you're doing. So I've got two questions which I will address to Mr. Kavala there. And I think the first one is more about basically law. Under which government ministry do the elderly people fall under? And keep that at the back of your mind whilst you answer the second question, because it's a big one, and I'll read it out. Mr. Koge is asking a question that one of the abuse or discrimination of the elderly that we witness is the denial of medical treatment interventions, especially for surgical operations. Amanena kuti awa akula sidibanga operate, what's the point? Afa bende at this wononge's minutes. And then we see care and treatment being slowly withdrawn. The patient notices and then they give up. Is this something that MANEPO or MHRC is noticing and dealing with? So I'm going to pass those two questions to yourself, Mr. Kavala.
Thank you so much. I will try to be brief. I know time is running out.
Thank
Uh,
you.
but just to say, before I pick on the two, on dementia, I wanted to give one practical example. I moved my mom from the village. She is a retired nurse. So I moved her from the village. I stay with her in my house. And she's got a very serious dementia problem. One day, she stays in a house that is in a room that is self-contained, but she moved from her room looking for the washrooms. She left the washrooms in her room and went into my daughter's room looking for washrooms. And when she opened the door, my daughter was so scared. Gogo, what are you up to? This is 12 midnight. And I'll tell you what, if this was in the village, my mom was gone.
Oh, yeah.
That was immediate stoning and death. I want to say how serious the issue of dementia is, but that's something else for another discussion. I'm sure Tiziwe and Chai to organize another discussion just on dementia alone. But in this case, one is the Ministry of Gender, Children, Disability and Community Development. That's the line ministry in Malawi, where you have all these issues being domiciled. Gender, children, disability and community development. I have seen the question. That question, Mr. Christopher, you are very right. Mr. Damandani, rather, you are very right. We have serious problems. We have recorded 18 cases at Manepo where older persons were denied access to services, health services across a number of government facilities in Malawi. The worst one was in Ncheu, where they were told point blank, we only have very limited medication which we are keeping for the youth. You have had enough in this life, so please give a chance to the youth to live longer like you. I might not give all the examples, but I think as Malawi Human Rights Commission, as MANEPO, we are taking this as a violation of a fundamental right. Every Malawian has the right to life, and the right to life speaks a number of issues. Access to appropriate health services is another stronger cornerstone when it comes to strengthening the right to life. So that one is a very serious issue. You may wish to know that in Zomba, we are already pursuing another case to the court. When somebody called me and said, my mom went through ABCD when she went to this hospital. I want to talk more about the case because it's in court, but we have taken the clinic officer head on and we are prosecuting the case. I want to emphasize that these are real cases and we are not leaving them just like that. Maybe sometimes it's the issue of resources, but we have registered enough cases where access to health services remains an issue. What is so peculiar about all these things? Now, as I conclude, I wanted to speak about another strategy that we are doing, promoting intergenerational solidarity. Most of these cases are being perpetuated by the youth. So, Madam Tiziwe, Madam Charity nurses, you see, Malawi is still a youthful country, and most of those working in health facilities are the youth. So you have younger nurses graduating. They are all in our facilities. Thank you. But they are also the ones who are championing these cases. So, but what we do now, we are trying to champion the intergenerational programming so that the youth, including the youth on issues of aging and respect for older persons, promoting positive images of aging, and encouraging intergenerational programming. What we are doing is we are now working with the universities in Malawi. We are setting up age-friendly clubs in the public and private universities. We would want young kids, Charity Kiziwe, you have been with the University of Malawi. You know, we have so many clubs in the universities. So we are also opening a new club in the universities where people can come together and speak about the aging. What is it? What do we need to do? And how do we ensure mindset change across the country? So that again is one practical approach to ensure that elder abuse is properly managed. I don't want to talk too much, but one last thing, moderator, allow me to speak about it. Otherwise, I won't be happy if I don't talk about it. Issues of access to justice. What we have noted through some studies is that older people are too scared to speak about abuse. And the abuse cases take place in private houses in the communities. And for you to intercept those cases, you need somebody to speak about them. And what is happening is when an older woman, an older man is abused, people tend to treat that as a family issue. So what has been happening is when a case is reported to us, we are beginning to pursue the case through the legal system. An older person will come and say, I have withdrawn, I won't be the witness in this case. So this is a very serious case. I know access to justice has to speak to some cultural context. So we are encouraging older persons across the country to begin to understand that we can only end elder abuse when they are also very willing to provide evidence in court. But this is a very big problem. They will report to us today. The next thing we tell them, let's go to court, they will say, no, I have withdrawn. After all, is my grandchild. I can't afford to see them in prison. So we are working around issues of access to justice to ensure that the perpetrators are taken to book. Thank you.
Thank you, Mr. Kavala. What I've actually just done is I've put in the chat. We had a conversation with Judge Zwone Ndaba, who talked around the legal framework and around what government is doing and around how they're protecting and utilizing the law to protect and support our elderly. So for those who are asking those questions, please take time to listen to what Judge Zwone Ndaba has said, because she expanded on that a bit more. And I wish we had time, because I feel like we've just scratched the surface. There's a lot to discuss, and it's showing us that I think we need to have a lot more conversations. But I just want to ask my panel one last question in terms of what is your call to action? So, as we're marking the World Elder Abuse Awareness Day, that was yesterday, what is the one message or action you would like everyone listening today to take away and to commit to? I like action. Ethel likes action.
Sala.
Yes,
Sala.
go ahead,
So
Charity.
yeah, while the our speakers are giving
I'm
their,
thinking,
you know,
yeah.
the nuggets, I just wanted to launch a small poll, really. So I'll launch it, but that shouldn't disturb the flow of our
Okay.
speakers.
Okay.
Yeah.
Yes. So
carry on.
yeah, Charity's going to put a poll on the screen. Please answer that poll, but I'm going to go around with our speakers, and I'll start from the person who spoke last, and that was Tidziwe. Tidziwe, what is your call to action? What is that one thing that you'd want people to take away today?
I think I'll be a bit unbiased on there, because you know where my passion lies. So I would say it's help where you can, using the existing platforms.
Thank you. Help where you can. I've just put the QR code in the chat. I think the question requires a QR code. People can't click on the screen.
Oh,
Brilliant.
okay.
Yeah. And I'm going to ask Ethel, what is your call to action? What is that one thing you would ask people to do and to take
Action.
to action? Yes.
Action speaks louder than words. Whenever you see an older person, be kind, because some things that we are looking for, they are actually hidden in those older people, but we are not aware of. There is a blessing, a special blessing that an older person carries. I have seen it sometimes when they speak a word in my life, a lot of things they happen. So all I can say is be kind, Action speaks louder than words. Let's love our older people. Remember, today it's them. One day we are all gonna be like them also. Tizakalamba tosefe. Sono tikazakalamba wina kumaza tichula sofiti. Sizakhala bwino. So let's be kind. Whatever we sow today, we shall reap. If we sow kindness, we will reap kindness. But if we sow wickedness, wickedness awaits us. Thank you so much.
Thank you, Ethel. My key takeaway is kindness. If you can be anything in this world, be kind. Mr. Kavala, what is your one thing that is your call to action that you want people to action from today?
Now, as a human rights expert, my key takeaway is human rights principles alone do not improve lives for other persons unless they are translated into implementable action. So closer to what Efro said, my worry is Madam Charity hinted when she spoke. In Malawi, we have so many laws in place, so many policies in place, but implementation is next to zero. My takeaway is let us move away from mere rhetoric to action. If we do that, we are done. So all these we are talking about, Older Persons Act, all policies, all these, they are on paper. Nothing else would change anything unless we decide to ensure that we translate them into action. Thank you.
Thank you so much. Charity, I'm asking you that same question. What is that one takeaway? One thing to action.
Action. Action. Do something.
Action.
Do your bit. Let us all do our bit. Little
And
or small, but let's do
little or
something.
small. Okay,
Yeah.
I'm gonna talk about action. So I also want to take some action, and I want to make a decision here and ask our members. I'm going to open up a poll for the next week for those who are willing. This is what I would call a coalition of the willing. Something that Idziwe mentioned and something that Ethel talked about, that they are looking for a piece of land and they are 2 million kwacha short. 2 million kwacha, which is equivalent of about 450 pounds. I want to ask our members, our people here, can we come together in the next 2 weeks? Because I know month end, wait, right? So up until the first week of the next month, let's put our one tambalas together and we can hand that over to Ethel as a coalition of Muna taking action. It will be a once-off. It's just a call to action that we can do now. Go home, think about it. We got £5, we got £1, we got £50, and I'm committing to £50 today. I'm committing to £50 today, and anybody else, whatever you want to commit to, please reach out to me, and in the next 2 weeks we'll put something together so that we can help Ethel make sure that they get that land. That's my call to action. Thank you.
Can you send bank details or something where we can reach out to you?
Yes, I'll send it via WhatsApp and I'll do that for the next 2 weeks. And this is me as an individual asking it. I'm not asking others, but it's what's on my heart. And if anybody else wants to join me, please do join me. Thank you so much. And I know
Thank you, Sala. Thank you for that call. Yes, I think we'll move into action. It will move us into action. It's £450 or an equivalent of that.
So now we need £400. We need £400. I've put 50 there. We need £400.
Absolutely.
And if we can get 40 people to give us,
let's make this happen. Thank you.
Brilliant. Thank you. Now we are nearly at the end, and I know I know that Charity has put a question, but I want to give everybody who was on here today, I just want to say a massive thank you. And I do want to give you 15 seconds each if you've got any burning things you want to say. Last line before I close this session, and I'll let Charity say something before I close. And I'll go back the other way around. Mr. Kavala, 15 seconds. Any burning last words? Goma, thank you so much.
No, but just thanks to the organizers and those who joined us. I think it's been a brilliant conversation. And perhaps we could consider maybe having these as series, maybe on a quarterly basis. I think they're quite enlightening. Thank you.
Thank you, Mr. Kavala. Ethel?
No, thank you so much. Me as well, I just want to thank you, Mona, for the opportunity. Oh, it's quite a lot. I'm even holding my tears, but thank you so much, Mr. Kavala. I only see him on the news. See what you've done. Now I'm able to see somebody that I always look up to, you see. So I'm so honored. Thank you for the opportunity. And Enrich Malawi, thank you so much for coming on board, and everybody who joined. We are here because you are there. Without you, we cannot function and operate the way we are operating. Thank you so much. I really appreciate your cooperation and your effort for us to be here. Taimirira Gogo 135, they could not speak on their own, but Tayankulira like this. Thank you so much.
Thank you, Ethel. Tidziwe, your 15 seconds of fame.
It's just to say thank you so much. Firstly, to Enrich Malawi. I love working with you guys. And thank you, Muna. Thank you, Andrew. Thank you, Ethel. And thank you, Ethel, for making us. You work really well with people, and I can encourage you to continue working that way, and Mr. Kavala as well, because remember, we are looking for collaboration. If we are a team, we are going to work well together. So keep it up, guys. Thank you.
Thank you. And Charity, I'm just going to pass to you. You put a poll in there. What's the poll saying? And then your final words, please. You're on mute.
Mute. Yeah, the poll really, I was just trying to sense check on how people feel in terms of nursing homes, but it looks like we've got a very positive mindset. Right or wrong, there's no right or wrong answer because it's a personal choice, right? I did ask that, would you put your parent or somebody close in a nursing home if they needed to? And we got about 69% say yes and 33% say no. And I wouldn't judge the person who would say 33% because probably that's a very difficult decision to make. Truly, truly, truly. It's a very difficult decision. It takes a lot for people to do that. So no judging. And would you have an advanced care plan to say you'd go in a nursing home? Quite 73% said yes, they would have a, so like, whoa. And I think these are important things that we need to be discussing and decisions that I think we need to be making and make our children aware as we're getting there, what we want to happen to us. So those are the two key questions that I did put. So thank you for all that taking time to respond to this. But also, I just want to thank you to you, Salah, as our moderator. You kept us really in check. Thank you to our speakers, Tidziwe, Ethel, and Mr. Kavala, and for everyone who joined us today. This webinar has reminded us that elder abuse can take any forms. As our speakers have said, it could be physical. Very painful to hear what Ethel had to describe from what she's interacted with. Emotional, it could be financial, it could be sexual, it can be seen in different forms: neglect, isolation, coercion, where like give me some money. And Mr. Kavala has mentioned this very well to say that, you know, our grandparents or our elderly love us so much, and they wouldn't want to put their grandson, granddaughter in trouble. And they would hide and hide it. They'll suffer in silence. So whether we're in United Kingdom, in Malawi, in Zambia, in Zimbabwe, in Philippines, India, abuse of older people is not a private family matter that should be ignored. It's a safeguarding concern, and it's a health concern. It's a human rights concern and a matter of social justice. So our call today is we all have a role to play, and we must be willing to notice, to listen, to ask those difficult questions, and to act when something doesn't feel right. So we must ensure that our older people are not spoken about without being spoken with. Their wishes should be taken into consideration, their experience, and their dignity should be maintained. So for Mona today, as you've called, you've asked us, Mr. Kapala, this is not the end of conversation. It is part of the wider commitment to education, to advocacy, to professional learning, and creating those stronger links between communities in Malawi and the UK and the diaspora as well. And I hope we could do something in Chichewa. I probably would say some of us probably our Chichewa wouldn't be up to scratch, but we could try, or we could get our colleagues who are very good at Chichewa, because I think this is the message that should enrich, that should be shared on with the communities that we want to reach. So I hope each one of us lives today with one clear commitment to challenge ageism, to speak up when we see harm, and to help create safer families, services, communities, to speak in our churches. But most importantly, I want to say thank you again for your time, for your openness, for your contribution, and for making this conversation really interactive. So on behalf of Mona and the Mona executive team and our members, I wish you all a safe evening. Thank you so much. Over to
Th-
moderator.
Thank you, Charity. Pamene pomamalizatu mawu ndibe maonena. But I would like to quote from the great book that says that my people perish for the lack of knowledge. And everybody here has talked about education. There is something about education in our homes, in our schools, in our communities, where we need to talk about ageism. So we need to educate one another so that our elders are not perishing because of the lack of our knowledge and our understanding. And it begins with us. And if we are to be anything, like Ethel said, let us be kind. Let's be kind to one another, and let's be kind to our elders. Amene ndo akulu anati samala anati sunga. Ndi miziko ndi amene they've done so much for us, and that will be us in the next 10, 15 to 20 years. Think about how do we want to be treated when we are in their shoes. And so let's show that same kindness. And on that note, I just want to say thank you to everybody who's managed to stay with us until the end. We started on Malawian time. We are trying very hard. Honestly, we're trying very hard, and we're finishing on Malawian time. Koma, thank you so much for staying with us to the end. We have recorded this session. We will share the link, and you can share this with those who missed today. And as Mr. Kavala has said, this is just the beginning of the conversation. Keep an eye out for more. Eddie, he's twisted our arm. You see that? Eddie, apanga china chake kuti, ichi ndi chiyambi. But the conversation needs to continue. So on that note, for those kumalawi zikomo kwambiri tikudziwa kuti mayenera kuti mukugona pano. We've eaten into your time, but I hope it's been a blessed session. And we keep this room open for the next 10, 15 minutes, but we're happy to release people. And I just want to say thank you once again. And we'll tell people you can open your mics if you want to just have a chat. We stay around for a little bit. Koma otherwise, zikomo kwambiri mugone bwino. Tiwona naso. Zikomo.
God bless. Good night.
God bless. Good night.
Good night.
Yeah. Are you going to stop recording, please?